So we were all geared up and ready to introduce STEADI as an in-clinic fall initiative. And we were all set. And then the pandemic happened and we had to pivot and do something else. We had to figure out how to make it work. We had to figure out how to change things in such a way that it would work in the home. And that involved a camera and talking to patients about camera angles so that we could see the full body when they were doing gait and mobility exams. So STEADI Telemed is a remote or virtual rendition of the STEADI initiative. It allows a nurse to assess and screen a patient for fall risk while they're in their home. So one key factor for implementing STEADI Telemed was having a patient and provider introductory call prior to the RN actually seeing the patient. This call served to allow the patient to prepare their home for the assessment, and there were several steps to that. Having an additional person present as a spotter during the tests that required movement, measuring 10 feet for the timed up and go test and 5 feet for the vision check, putting a chair in a corner where it wouldn't move for the chair sit to stand assessment. Also, early provider buy-in and identifying clinical champions helped establish the initiative and the program into different departments. Some additional key elements that helped the STEADI Telemed succeed include integrating STEADI components into the clinical electronic health record system, including STEADI assessment findings into clinical workflow, and creating an electronic health record note template that allows providers to clearly record relevant outcomes for each patient. Some advantages to implementing STEADI Telemed include allowing registered nurses to remotely assess potential home hazards that may be missed during in-clinic assessments, addressing previous patient barriers to STEADI, such as limited transportation or scheduling conflicts, allowing more time for the registered nurse to assess patients thoroughly, address patient concerns, and provide extensive patient education.